Well, in the last few minutes, Nigeria's president has declared a national state of emergency. One is already in place in Liberia, where nearly 500 people have died alone. A short time ago, I spoke to journalist Gabriella Jozwiak, who's in the Liberian capital, Monrovia, and I asked her whether people there are afraid.
Yeah, here in Monrovia, people are very tense. There's a constant awareness of this epidemic. It doesn't matter what conversation you start, it will always end in Ebola. Every time you enter any public building, a bank, a restaurant, a hotel, just a normal shop, everyone's now got these buckets of water and chlorine outside, and you're asked to wash your hands before you go in and as you leave. People are also very aware of physical contact because they're believing that if you even touch the skin of someone, you could catch Ebola. So people are not brushing shoulders, you don't shake hands, you don't kiss anyone, you don't hug anyone.
Is there a sense they're in the middle of what the World Health Organization is calling an international health emergency?
Absolutely, and I think the term international is very important here because a lot of people are feeling abandoned by the international community. They're very aware that this has been reported in the States and in Europe and in the UK. They know that the British Airways stopped flights to this country. They know that lots of foreign nationals have just aborted, just jumped ship, especially a lot of the NGOs that were here supporting people. And they're feeling really isolated, and there's starting to be quite a lot of anger that more isn't being done to help them because, as every newspaper is saying today, they cannot cope on their own.
I mean, they are calling it a state of emergency there. It was announced by the president on Wednesday. Having said that, we're now learning more facts about Ebola. It's actually harder to catch than the normal flu is. So do people still sort of treat it like a death sentence, or are they understanding that some people do actually survive it?
It depends who you're speaking to. I think here in Monrovia, you're getting a different kind of body of people who have been more educated, and they're taking precautions even though they know the facts. Outside of the city, in the interior of the country, people are a lot poorer, a lot less educated, a lot of them are illiterate, and they're the ones that are probably showing this fear that you're reading about in the press in the UK. I mean, right now it's rainy season, there's cholera around, there's diarrhea, there is malaria. The sad thing is that people presenting these symptoms now are either not going to clinics because they're afraid they will be quarantined with the people that have Ebola and therefore catch it, or they're trying to go to clinics but they can't go because so many health workers are terrified of catching Ebola. They are refusing to come to work and the clinics are closed. I've actually met some pregnant women this week who are saying that they're not sure right now where they can have their babies.
What about foreigners like yourself, Gabriella? I can't imagine there are too many of them around in Liberia at the moment.
Actually, Matt, I was here in March and I remember being quite struck by the number of foreigners that are driving around normally in the street. It's normally a very colourful city. This time, I actually have not seen anyone else apart from the people that I'm working with. I haven't seen a single other foreigner, just UN staff that are staying here. Many of them have left. I've met a few people in the international hotels who have managed to get flights home and they're all going. What I think is interesting is that a lot of them are saying they're not going because they're afraid, they're going because they're scared of being trapped here because of the way that the airlines have responded.
Gabriella, thanks very much indeed.
Thank you, Matt.